Welcome to the Radiology Review podcast, your on-the-go source for radiology education with your host, Dr. Matt Covington, a board-certified radiologist. Please follow the podcast on Twitter at RadRevPodcast. Send emails to theradiologyreview@gmail.com or visit the website theradiologyreview.com.
Welcome back to the Radiology Review podcast, your source for on-the-go board review. I want to thank each of my listeners who have taken the time to leave reviews. I want to read a recent review in which the review states, "So thankful Dr. Matt Covington made this podcast. He covers so many topics important for boards and practice. Great to listen to in the car, gym, or when you're just tired of reading. Thank you. This hits on all of the reasons why I was motivated to start this podcast in the first place. I saw a need for this type of radiology education, and I am really grateful that this has worked for many of you." On this episode, I will be presenting a requested topic pertaining to quality control in mammography. All of the quality control questions are often tested regardless of modality, but I think especially for nuclear medicine and mammography, these quality control questions are really key. I will present these topics of radiology QC in a question and answer format. I do have a link on my website, theradiologyreview.com, that lists the majority of the common tests and intervals for quality control for all radiology modalities. You can find that on my website. Look for the link for quality control parameters. I will also make a free downloadable study guide available on my website for quality control for mammography. That contains additional information that may be helpful for your board study and radiology education. Wherever you are listening, welcome, and I hope this episode is helpful for you. Let's get into the first question. What is the name of the act that specifies quality metrics for mammography in the United States, and what is the overseeing governing body of this act? Believe it or not, but this is a fair question for the ABR core exam, and I want to know if you can give me the name of the act that specifies quality metrics for mammography and what the governing body is for this act. The answer is that the Mammography Quality Standards Act, which is abbreviated MQSA, Mammography Quality Standards Act, as specified by the U.S. Food and Drug Administration, or FDA, is the act that specifies quality metrics for mammography, and this is federal law. Basically, MQSA specifies that you must follow manufacturer recommendations for quality control tests. However, the American College of Radiology, or ACR, has also received approval that its quality control manual and recommendations can count as an alternative to manufacturer recommendations and also satisfy MQSA requirements. I have placed links on the study guide that you can download that will take you straight to the ACR Mammography Quality Control Manual. And this is a great resource for anybody, whether for actual practice or board study, who wants more information on mammography quality control tests. That link for the ACR Mammography QC Manual can be found on Google or on my study guide for this. I also am pasting a link for a good radiographics article that covers mammography quality control as well. If this is a topic that is confusing for you, please read this radiographics article, and I think it will be helpful. Remember, the ultimate overseeing body for mammography quality control is the U.S. FDA, Food and Drug Administration. Don't confuse this with the ACR, although the ACR does have some recommendations that the FDA will allow you to follow. Ultimately, the overseeing body is, in fact, the FDA. Next question. According to the ACR, what is the purpose of routine quality control testing? As defined by the ACR Mammography Quality Control Manual, The purpose of routine quality control testing is to detect, identify, and correct equipment-related problems prior to those problems causing a deleterious effect on clinical images. So this is really important, and I wanted to point that out now to give you some motivation why these quality control questions may actually matter, because the purpose is to detect, identify, and correct equipment-related problems before these problems cause deleterious effects on clinical images. So understanding these tests is important for patient care. Quality control is about prevention and is designed to preserve the integrity of clinical images. That is per the ACR. Next question. According to the ACR, what is the definition of quality assurance? There is a difference between quality control and quality assurance. What is the definition of quality assurance? Quality assurance per the ACR comprises all management practices implemented and overseen by the lead mammography radiologist. Now, as explanation, each breast imaging group must have a specified lead mammography radiologist to oversee quality of the program. This is essentially the group's quality leader who will be responsible to implement and ensure that all quality control and quality assurance measures are followed. So again, quality assurance comprises all management practices implemented and overseen by the lead mammography radiologist. The goals of quality assurance are to ensure that every imaging procedure is necessary and appropriate, the images are of diagnostic quality, reports contain necessary information, and turnaround times are acceptable. The lowest possible radiation doses are given as part of imaging, and cost and inconvenience are kept to a minimum for patients. So all of these are factors of a high-quality practice. You have a lead mammography radiologist who oversees all of this, and that is what quality assurance is. Quality control is making sure that your machines are working correctly. Quality assurance is managing the overall quality of the practice in the many facets that can define quality. And important to remember that there is something called a lead mammography radiologist. They are the ones ultimately responsible for the group's quality, although it is obviously the responsibility of every physician to maintain quality themselves and in their practice as well. What is repeat analysis? Let's start to get into some of the tests. What is repeat analysis? Repeat analysis is the number of examinations a mammography technologist needed to repeat due to poor positioning, patient motion, or any other factor that resulted in a non-diagnostic examination or partially diagnostic exam. We want completely diagnostic exams, so in mammography, if we see a partially or non-diagnostic exam, the patient needs to return, you need to repeat the imaging, and we track this as part of repeat analysis. Repeat analysis per the ACR is performed on a, quote, as needed basis, end quote. I have seen some other sources saying that repeat analysis must be performed quarterly. If you are asked about repeat analysis on a test, I would answer that it should be performed quarterly. Next question. How often is the mammography phantom test performed? This is a really important question. Make sure you know this. How often is the mammography phantom test performed? The answer is weekly. Okay, every week you perform a phantom test in mammography. Next question, also extremely important for core exam. What are the three components of a standard breast phantom that must be assessed? The answer here is fibers, spec groups, and masses. Each breast imaging phantom from the ACR that you use has a group of fibers, a spec group, and masses, and you have to identify a certain number of each of these, which gets us to the next question. How many of each of these fibers, spec groups, and masses must be visualized in order to pass the breast phantom test? I cannot stress how important this question is. It is one of those must-know concepts. You absolutely need to know this. The answer I am looking for is that you must be able to see 4 of 6 fibers, 3 of 5 spec groups, and 3 of 5 masses on the phantom test to pass this test. This is so important. I will repeat this again. You must be able to see at least 4 of 6 fibers, 3 of 5 spec groups, and 3 of 5 masses in order to pass your weekly phantom test. If you do not have that burned in your memory, hit the pause button, repeat it 10 times in your head, and then continue. Next, what additional breast imaging quality control measure is checked on a weekly basis? Is it ViewBox/monitor check? Is it compression check? Or is it dark room cleanliness? Which one of these is performed on a weekly basis? The answer I am looking for is ViewBox conditions/monitor check. Now, ViewBox, for those who may not yet have seen it, is the box that sits on the wall that has a light inside of it, and you hang your film screen mammography images on it, turn on the light, and you look at it on the ViewBox. That is supposed to be checked for adequate condition and cleanliness on a weekly basis. For those of us reading digital mammography, which is pretty much all of us at this point, I would think, you would need to do a monitor check each week to make sure your mammography monitor is clean and functioning. Next, how often is the breast compression quality control check performed? And by breast compression check, I mean that you are checking the system that it can provide adequate compression. The answer is that the breast compression check is performed on a semi-annual basis. That is also important to remember. The next question is perhaps even more important to remember. How many pounds of compression are you required to apply during a mammogram? Again, this is super important. As a reminder, this is according to the Mammography Quality Standards Act, or MQSA, by the US FDA, that you must apply how many pounds of compression during a mammogram? The answer here is 25 to 45 pounds of compression are required per federal law. Very important, 25 to 45 pounds. If you don't have this fact in your head, hit the pause button, repeat it 10 times to yourself, and then continue. Next question. What is the mammography quality control visual checklist, and how often must this checklist be completed? Now, this is something that may not be in every board review book, but I think it is fair game. I think it's important to be aware of the mammography QC checklist because it is something that is specified by the ACR, and it is something that must be performed on a regular basis. The visual checklist is available in the ACR Quality Control Manual. Again, download the study guide to get that link. And this visual checklist asks about items such as ensuring cleanliness of equipment, checking the indicators on equipment for adequate function, checking cables, mammography paddles, tomosynthesis assembly movement, monitor conditions, etc. And this checklist must be completed monthly. It's basically a checklist that goes through a number of random items that are of importance to maintain a high-quality mammography program. You need to run through this checklist to make sure everything is good on a monthly basis. Next, what is the compression thickness indicator test, and how often must this be assessed? Now, I have to admit, this is probably something I did not know about as a resident. Maybe I did. If so, I've forgotten that I knew that. But it is something that is also specified and is fair game on your exams. The compression thickness indicator test is something that is performed each month what you do is that you use a compression thickness phantom and you test how accurately the compression indicator on the mammography system measures the actual amount of compression that you are given. So you put in this compression thickness phantom, which is usually something about 2 centimeters in size. And then you check to make sure that the compression thickness indicator is accurate to within 5 millimeters of the actual compressed thickness. Next question. How often is a medical physicist required to perform her equipment assessment? The answer is that a medical physicist must perform her equipment assessment at least once per year for breast imaging, and they also would perform assessments anytime that a machine has been installed or otherwise modified, moved, or altered in a significant way to make sure that everything is still functioning normally. The number I would keep in mind for this is a physicist check on an annual basis, and they have to certify that everything is working fine. Next, what are some screen film quality control tests that, although largely obsolete, could show up on the ABR core exam? I'll take any of them, list any that you can remember. Unfortunately, it appears that this still might be fair game. Full disclosure, I have never worked at a center that uses screen film mammography. This is largely foreign to me. Did I memorize this for the ABR core exam? Yes. Did I memorize this for my certifying exam? Yes, again. It's just something you have to know, and unfortunately, you still may see some questions on this. So some of the tests you need to be aware of are the processor check, darkroom cleanliness, darkroom fog, screen film contrast check. To try to help you out, we'll talk a little bit more about some of these. Next, what is the difference between darkroom cleanliness and darkroom fog? Darkroom cleanliness refers to literally removing dust and removing debris and other unnecessary materials from the darkroom. From my reading, what you need to keep in mind is that specks of dust or other debris could cause havoc in the darkroom where you are developing the mammograms to be interpreted. Dust on the mammogram could look very similar to calcifications. You don't want to have dirt or other unclean items, things that may have fibers that could get loose, etc., in the darkroom because these could get on the images and cause artifacts. So basically, this dust and loose debris could be really problematic and cause imaging artifacts on the films, so you had to maintain a clean environment, and to do so, you were required to do daily cleaning. So darkroom cleanliness was a daily task. Just remember that these rooms had to be super, super clean, and that would help you remember that you had to clean on a daily basis. On the other hand, in the off chance you were asked this, although the room had to be cleaned daily, the intensifying screen was to be cleaned weekly. To get back to this question, I asked what is the difference between darkroom cleanliness and darkroom fog. We just spoke about darkroom cleanliness. Darkroom fog, on the other hand, refers to how much stray light is able to enter the darkroom and inadvertently expose the mammography films. The way I remember this is that stray light getting into the darkroom could fog or cloud the images. So that helps me remember that darkroom fog refers to stray light that could potentially fog your mammograms. That's a problem, and you need to test for this on a semi-annual basis. Okay, you're cleaning the darkroom on a daily basis. You are checking for darkroom fog on a semi-annual basis. Next question. What are some components of the processor check, and how frequently should this be performed? The processor check should be performed daily. Components of the processor check include ensuring that the processor is cleaned and chemicals are replenished, rollers are in good condition, and apply proper pressure to the film, the temperature and humidity levels are okay, etc., etc. Hopefully you won't get into that level of detail on the ABR core exam because it is very unlikely that you will ever deal with these issues. However, I've covered it here just in case, and if you have more interest to learn about this, I've copied a link to a good article that discusses this further. That again you can find on the study guide that you can download at theradiologyreview.com. Next, how often is a screen film contrast test supposed to be performed for screen film mammography quality control? The answer is that screen film contrast test should be performed on a semi-annual basis. Let's just simply leave it at that. Next question. What is the flat field test and how often must this test be performed? The flat field test is a weekly quality control test in which a thick acrylic, which can be of different thicknesses as specified by the manufacturer of the equipment, is placed over the entire detector. So you place a thick acrylic over the detector without compression and you take an exposure. Note that this thick acrylic is different from the ACR MQSA Phantom that has specs, flex, and masses. This is simply a thick acrylic that is blank. And this is kind of more like a blank phantom test that allows you to evaluate things like brightness and signal to noise non-uniformities. It allows you to evaluate for bad pixels. It allows you to look for high frequency modulation and so forth. I sort of think of this as the mammography equivalent of the nuclear medicine flood test for gamma camera images, in which you look for things like faulty or bad photomultiplier tubes. With the flat field test, you are putting a thick acrylic over the entire detector, taking an image and looking for things like non-uniformities and bad pixels. Along with quality control tests, you will have many questions on imaging artifacts, and I would expect you'll probably have some imaging artifact questions in mammography as well. And since imaging artifacts are one of the primary purposes of performing quality control testing to ensure that artifacts do not end up on your image, that could interfere with your clinical interpretation. As a bonus, let's go through a few artifacts I think you should be aware of. Definitely not an all-inclusive list, but let's go through a few of these. First, what is ghosting artifact and how do you prevent this? Ghosting artifact can occur in mammography. You may have heard about ghosting artifact on digital radiography, but I want to put a plug out there that ghosting artifact can also occur in digital mammography. And ghosting artifact happens when a previously acquired image ends up being superimposed on the current acquired image. To correct ghosting artifact, the detector needs to be recalibrated, or essentially the memory of the detector needs to be wiped clean. That will remove the prior image from the detector, and then you can acquire the new image. So, ghosting artifact. Next, what are two common interventions a technologist can do to remove motion artifact from an image? This is not an all-inclusive list. Yes, I am going to ask you to read my thoughts, but can you come up with at least two measures a mammography technologist can implement to minimize motion artifact? The first I would propose is to increase the amount of compression. Increased compression improves mammography images for many, many reasons, but one of them is that it helps immobilize the breast, which can reduce motion artifact. Additionally, by compressing the breast, it allows the automatic exposure control to potentially trigger a shorter exposure because you have less thickness of breast that needs to be exposed, and that faster exposure can also reduce motion artifact. Second, the mammography technologist can simply remind the patient to remain still during the imaging. Motion artifact is super important on mammography, and you identify this as blurring of the image. If you do not know how to detect motion artifact on a mammogram, please ask your breast imaging attendings, Google some images, see what the blur looks like. It can be subtle, but this is totally fair game on the ABR core exam. Motion artifact may be especially bad for evaluation of calcifications, and if you have motion artifact on a mammogram, you may simply not at all see calcifications even though they are present, and I have seen that a number of times. And whenever I see that, I point that out to residents or fellows I may be working with, where perhaps the technologist took a mammogram that had motion and then repeated the image, and I go and look at the mammogram that has motion and there are no calcifications, and then I pull up the image that was subsequently taken that does not have motion, and suddenly you see calcifications. An additional tip is that if you are performing a stereotactic guided biopsy of calcifications that are subtle, and you get in the stereotactic biopsy room and take some scout imaging, and you do not see the calcifications despite being confident that you are imaging the right area, one measure you could try to help you see those calcifications is to slightly increase the compression, and you may start to see the calcifications that you previously could not. Next question. What are electrical readout errors, and how do you identify these? Electrical readout errors are also known as vibration artifact. That is, again, vibration artifact. Electrical readout errors / vibration artifact result from electrical interference in the mammography system, and these are seen as vertical dark lines across an image, sometimes which may show alternating dark and bright lines throughout the image. If you see these vertical lines across a portion of the image, one thing you should consider is electrical readout errors, which is also known as vibration artifact. And if you identify this and it repeats on additional images, the detector needs to be serviced. Last question for this episode. What is gridline artifact? I consider this an extremely high-yield concept for ABR core exams. What is gridline artifact? Gridline artifact occurs when the bucky that holds the anti-scatter grid oscillates too slowly or even may stop, and you are then able to see the lines from the anti-scatter grid on the image. The grid lines are often seen, at least in mammography, as repeating lines at a 45-degree angle, and typically those lines will span the entire image. Unlike electrical readout errors that show you vertical lines on a portion of the image, gridline artifact, from my experience, typically will manifest over essentially the entire image. And if this artifact persists, the mammography unit also needs to be serviced. And again, the cause of this is when the bucky, which is kind of the tray that holds the anti-scatter grid, and normally oscillates quickly so you don't see the grid lines on an image. If it oscillates too slowly or even stops oscillating, suddenly you will see those grid lines, and that can be a problem, and it is something that needs to be addressed and fixed. I have also posted a link for a good article covering mammography artifacts that you can find and check out on the study guide that you can download on my website, theradiologyreview.com. I have listed on that study guide many links to ACR documents and articles that may be helpful for quality control and mammography artifact learning. I hope this has been helpful for you. Keep up the good work, study hard. Remember, you have to study really hard to succeed on radiology board exams. So prepare to succeed. I will catch you on the next episode. Content of this podcast is provided for informal educational purposes only for radiology trainees and radiologists. Medical practitioners, please make your own independent assessment before suggesting a diagnosis or recommending any course of treatment. This podcast should not be used for self-diagnosis or self-treatment and is not a substitute for independent professional medical care. Please consult your own physician regarding any diagnosis, imaging interpretation, or course of treatment.